Favola.
Thank you, Madam Chair. I'll now turn your attention, if you will, to Senate Bill 421. And this is an interesting bill. It came to me from some healthcare practitioners at an opioid treatment center in Charlottesville. And what this bill does is it changes the current law to allow a licensed pharmacist who can oversee the assembly of an antagonist drug virtually. So a patient can leave the clinic with the drug. Current law requires a pharmacist to be on site while the antagonist drug is being assembled. If the patient would be allowed to leave the clinic. Again, the pharmacist would have to be on site according to current law. But virtual medicine has really taken hold. And in cases such as I've explained, there are areas where we don't have enough pharmacists. So to allow them to oversee virtually the assembly of an antagonist drug so the patient can leave with that drug is a huge benefit. It's certainly a cost savings. It enables the patient to leave with the medication they need so they don't have to return. And it fills a gap in our spectrum of care. I am pleased to say I did work with the UVA Law Clinic on this, so we wanted to interview many clinics, and we wanted to work with the Board of Pharmacy and a number of other stakeholders and the legal clinic at UVA. I think Dr. Block is the head, but I had two law students. One of them is here. She traveled from Charlottesville and wants to speak to you. And also the psychiatrist who is overseeing the clinic that brought this issue to me is here. So if you would indulge my two speakers, that would be wonderful.
Let me first, you can come on up. Let me first just go to the subcommittee. Are there any questions for the senator? Seeing none, if there's anyone in the room that would like to speak in favor of the bill, please come forward.
Good morning, Madam Chair and members of the committee. My name is Tara Jones, and I'm a student with the University of Virginia School of Law State and Local Government Policy Clinic. The views I'm expressing today are my own. This session, I've had the privilege of working with Senator Favola on SB 421, and I'm here today to ask you to vote for this important bill. SB 421 will make it easier for people in recovery from opioid addiction to get the treatment they need by allowing virtual pharmaceutical supervision for take-home doses and opioid treatment programs. By way of brief background, there are more than 50 of these programs spread across the Commonwealth, and they provide outpatient treatment and medical management for thousands of people in recovery from opioid addiction. As part of their duties, these programs prescribe patients with daily doses of medication such as methadone and buprenorphine to treat opioid use disorder. As Senator Favola mentioned, right now, authorized practitioners in these programs, such as registered nurses, can pour patients in-person doses of these medications, but cannot pour the same drugs when they are used for take-home doses without on-site pharmacist supervision. But due to pharmacist shortages, pharmacists are not always on site to supervise the pouring of take-home doses. This results in patients not being able to receive their take-home medication and having to disrupt their work schedules and often travel long distances just to receive their daily dosage, creating an unnecessary barrier to both treatment and recovery. SB 421 will address this problem by allowing virtual pharmacist supervision. This change is permitted by federal law and follows 35 states having taken similar or even more expansive measures. Further, Virginia has already successfully piloted this approach in several places under a new program supervised by the Board of Pharmacy. Senator Favola consulted with many stakeholders in preparing this bill, including staff and leadership from the Board of Pharmacy, staff at DBHDS, the Virginia Pharmacy Association, and OTP providers themselves. SB 421, in short, will make a modest, careful change to Virginia law that will have a big and positive impact on people in recovery. For these reasons, and those you may hear from others, I respectfully ask that you vote for this bill.
Thank you. Is there anyone else to speak in favor of Senate Bill 421? Please come forward.
So good morning, members of the committee. I'm Dr. Shay Tinsley, a licensed psychotherapist and healthcare practitioner and director here in the Commonwealth. I brought this issue to Senator Favola last year because in my years of overseeing various addiction recovery programs, I've witnessed firsthand how people in recovery will drive up to 5 hours for the medication that they need, only to be told that they have to come back the very next day for take-home doses because a pharmacist isn't physically there to authorize the pour of their medication. And this is in the moment when you have to deliver that news. It is devastating for people because it creates a lot of chaos. And in recovery, what you need is stability. It can be very triggering. So I understand that the current limitations are well-meaning. The red tape actually disrupts the timely and practical delivery of care for the people that I serve. So the bill that we're proposing ensures continuity of care by allowing remote pharmacist oversight. So we're not removing that oversight. We're just saying that if a pharmacist isn't physically there, we can still deliver the medication that our patients need. This will also increase the flexibility of our OTP programs, and it will ensure that no patient's recovery hinges on avoidable barriers like weather or pharmacists being out sick or whatever that might be. So with your support, we can empower every opioid treatment program in the Commonwealth to deliver consistent, reliable care. Thank you for your time.
Thank you.
Madam Chair, members of the committee, Robert Melvin with the R Street Institute, wanted to speak in support of this measure and thank the Senator for carrying this bill. It's going to do a lot to help address some of the operational challenges that exist at a lot of these OTPs. And when they have these sorts of barriers that exist, it prevents them from expanding. And when they can't expand as a result, then they're unable to meet newer individuals that need this treatment. And so it's really important that y'all pass this measure and also for the other reasons that were mentioned previously. Thank you.
Is there anyone here to speak in opposition to Senate Bill 421? Coming back to the subcommittee, Delegate Downey.
Madam Chair, a question for the patron. Is this being done by pharmacists for any other kind of remote kind of monitor or remote access in the Commonwealth?
This is being done now in a pilot program. There are 8 pilots that are currently using a virtual licensed pharmacist. So it has been working so well. I worked with, of course, Caroline Horan, rather, who is the staff person for the Board of Pharmacy, and she gave us information on the 8 pilots that are currently underway, and they're very successful. So that's why we thought we should take it statewide.
Delegate Hodges.
Thank you, Madam Chair. Speaking to the bill at the proper time. Thank you, Madam Chair. I would just like to say thank you for bringing this legislation forward. It is needed. You know, it's been proven telemedicine and virtual works. And, you know, when I look at our rural areas and the problems with the pharmacy deserts, and we don't even have a federally certified opioid treatment facility in, you know, the entire Middle Peninsula or Northern Neck. So access is crucial, and the counseling is very important.
Yeah.
But I would also like to say you have a great team. I've worked with Dr. Block in the past and his students on legislation, and they do a great job.
They do.
You know, doing the research and following through, and I'd just like to thank them for all they do and commend Dr. Block and for his hard work and bringing these students under his wing to see how we operate up here at the General Assembly.
There was another student, Mr. Salazar, who had another commitment, but so there were 2 law students. I just wanted to give him a shout out. So yes, you're absolutely right. They were tremendous.
Coming back to the subcommittee. It's been moved and properly seconded that we would report Senate Bill 421. Seeing no further questions, if the clerk will please open the rolls and members cast your votes. And that is recommended to be reported on a vote of 10-0.
Thank you, Madam
so
Chair.
much.
Thank you, colleagues.
The committee will be at ease.